Could your constant fatigue or joint pain be something more than just stress or aging? It might sound unlikely, but these everyday symptoms can sometimes mask a much more serious condition, including bone cancer. Hi there, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. That's why everything I'm about to share with you in this video has been reviewed and approved by real doctors from our UB team. Let's get into it. Bone cancer is rare, but it can be devastating if it goes undetected. Because its early symptoms often look like everyday aches and pains, people brush them off. But knowing what to look for could make all the difference. Let's start with one of the most common early red flags: persistent bone pain. This isn't the kind of soreness you feel after a good workout or a long day on your feet. This pain lingers. It sticks around even when you're resting and can get worse at night. I once reviewed a case of a high school athlete who kept icing what he thought was a minor knee injury. 3 months later, he was diagnosed with osteosarcoma, a form of bone cancer. Early attention could have changed the outcome. Another sneaky sign? Swelling near joints or bones like your knees, shoulders, or hips. At first, you might think you just bumped into something. But if that swelling hangs around or gets worse, it could be your body waving a red flag. Then there's something we all blame on getting older: reduced mobility. Can't reach behind your back or climb stairs like you used to. Don't be so quick to chalk it up to aging. If stiffness or difficulty moving is new or worse than usual, it could be linked to something deeper. One particularly alarming symptom is unexplained fractures. If you've ever broken a bone doing something low impact, like stepping off a curb or opening a stuck window, don't ignore it. When bone is weakened by cancerous growth, it becomes fragile. Even minor pressure can lead to serious breaks. There are also more subtle signs to be on the lookout for. Sudden, unintentional weight loss, even while eating normally, is a major one. This happens when cancer begins affecting your metabolism. Loss of appetite, fatigue, and an overall sense of body weakness can go hand in hand. Let me tell you about a woman named Karen from our user community. She's 48, active, and generally healthy, but she started experiencing night sweats and random low-grade fevers. She assumed it was early menopause. Luckily, after visiting her doctor, she was diagnosed early and received timely treatment. Signs like these, especially if they persist, should never be ignored. Now here's one many people find surprising: numbness or tingling in arms or legs. If a tumor begins pressing on nearby nerves, it can lead to that pins and needles feeling or even loss of sensation. In rare cases, bone cancer can even start interfering with nerve pathways. Also, if you find yourself getting sick often or struggling with lingering infections, it may be time to take a closer look. Cancer can weaken immune function, making it harder for your body to fight off everyday bugs. So, where does bone cancer spread first if left unchecked? Typically, to the lungs and nearby bones. Symptoms like a persistent cough or difficulty breathing may show up next, and that's when things become more complex to treat. And how long can bone cancer go undetected? Sadly, months or even years. That's because many of the early signs are so subtle and so easy to mistake for stress, injury, or aging. So, what can you do? First, listen to your body. If any of these symptoms feel familiar, don't wait. Ask your doctor about tests like X-rays or MRIs. And if your concerns aren't being taken seriously, get a second opinion. Early diagnosis significantly improves treatment outcomes. Home remedies alone won't cure bone cancer, but managing symptoms like swelling or pain can help. Ice packs, over-the-counter anti-inflammatories, and gentle movement or stretching may provide temporary relief, but they are no substitute for medical evaluation. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade. Doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And don't forget, hit like and follow for more doctor-approved info you can trust from UB Health. Stay curious, stay safe, and stay informed.